अभी तो मैं कैसे जाऊँ, सामान आएगी, आप इधर बैठो, अंदर कैसे काम करवाऊंगी, फिर आप आओगे फिर चले जाओगे, फिर आप घर में रहोगे तो मैं वो ऊपर आ जाऊंगी। आप वहां से निकलोगे ना तो मेरे को फोन कर देना, तो मैं तैयार हो जाऊंगी, खाना खा आपको।
Vivek, I think we can start now.
Yes, sir. TP ma'am?
Yes, sir.
I think, Chalu sir, can we start now?
Yeah, please.
DP ma'am, you can start now.
Okay.
I think we can start now.
Okay, thank you. Hello, namaste, and a very warm good morning to one and all presented here. And thank you so much for joining us for today's webinar. I am TP Singh, Assistant Professor at Government Engineering College, Bilaspur, and your host for the session. It's my immense pleasure to welcome you all to this national webinar organized by State Project Implementation Unit, that is SPIO Chhattisgarh, in association with Government Engineering College, Bilaspur. We are living in an era where technology is the propelling phase of every sector, and medical science isn't an exception. The power of technology becomes evident every day, especially if we talk about the current pandemic situation. COVID-19 threatens the survival of human beings. The tiny virus has expanded its active presence across the continents with an impactful footprint in more than 175 countries. All of us are concerned about the exact recovery path that the technology and medical science will take to rise beyond. But all of us are certain that technology integrated medical science will definitely find a perfect way out. And that's why, in this regard, SPO Chhattisgarh, in collaboration with Government Engineering College Bilaspur, is organizing this national webinar titled Technology and Medical Science, a Historical Perspective and Where We Go From Here, presented by Dr. Rajendra Kumar Jha, former professor and the head of the Department of Medicine, RIMS Ranchi. He has completed his MBBS and MD from Darbhanga Medical College and Hospital. He carries over 40 years of long and vast experience in the field of medical science. Starting from assistant professor, he worked successfully as the head of the Department of Medicine, RIMS, and superannuated from service in the year 2016. He guided more than 30 clinical research projects, leading to the award of Doctor of Medicine. He has more than 50 research publications in various international and national journals and conferences. He is also a fellow and life member of several prestigious medical bodies like Association of Physicians of India, Association of Neuroscientists of India, and many more. He is also founder chairman of Indian Association of Rheumatology for Jharkhand. So, we extend a warm welcome to you and really thankful to you for joining us for this session. Moving ahead, a good administrative professional is one who brings, supports, holds, and streamlines both their team and organization together. With this, let me invite Mr. Diwakar Mishra, State Project Administrator at SPIO Chhattisgarh, to deliver his welcome address. Sir.
Good morning to all of you. On behalf of SPIU Chhattisgarh and GEC Bilaspur, I welcome Dr. Rajendra Kumar Jha, Professor and ex-HOD Medicine, RIMS Ranchi. He is an excellent doctor and very good counselor. Plus, he has taken up the recent contribution of it to pioneer Ranchi weekly column based on his vast experience of 40 years of practice so that it becomes accessible to the common people. I also welcome Dr. B.S. Chawla, our most dynamic principal of Government College, Engineering College, and one of the best in Chhattisgarh. I welcome all the eminent respected faculty who are attending this webinar and dear students. The topic is very interesting, technology and medical science. Sometimes I think, are they really different? Last 1 year has been particularly challenging for all of us, as DP has already said. But at the same time, we must also note that it has provided a wonderful and amazing collaboration between doctors, technologists, chemists, and all scientific community, with the result that within a year, we have about 6 vaccines available for all of us. We will get over the present crisis soon, but we must also remember the good things that we have learned during the last year. Most of us confined indoors were really had a real look at the beautiful birds, listened to the melodious sounds, butterflies, enjoyed clean air and clear view. So we must not go back to our old ways, plus the importance of hygiene and cleanliness, especially the hand washing. It must be carried forward. And all the organisms in the world, they are a part of the complex web system and food chain. This virus is supposed to have originated from bat. So any disturbance in the system will result in a more severe pandemic and bring untold misery to the people. So with these words, I thank everybody present and I trust that you will listen attentively and ask questions, queries, and give suggestions to us so that we improve. Thank you very much.
Thank you so much, sir. One should be an expert, but when you are a leader, you do things the expert can't do. With these words, I would like to invite Dr. B.S. Chawla, Principal, GEC Bilaspur, to address the gathering.
Thank you, Dipi. Good morning, all. Guest speaker of this joint webinar, Dr. Rajendra Kumar Jha sahab, most respected Sri Diwakar Mishra ji, IFS, State Project Administrator of SPIU. First of all, I thank you, sir, for posing confidence on us and giving us an opportunity to organize this webinar jointly with you. GC has achieved whatever height today is mainly because of your blessings and your support. In this World Bank project Take Up 3, in every step we got your blessings and support so we could reach to this position, sir. today's topic of this webinar, technology and medical science, is very much relevant. As we know, all the cure, it starts first from diagnosis. If diagnosis is proper, only then we can expect the cure will take place. And we all are well aware that diagnosis nowadays is purely dependent on equipments, instruments. Whenever we go to any hospital, first of all, doctors advise us to go for various tests. Those all tests are carried out in the equipments which are designed, manufactured by engineers, by technologists. So we can say that nowadays interdisciplinary kind of research and outcomes, these are expected. You all must be aware, IIT Kharagpur is successfully running medical courses in their campus. It's the first IIT in India. So MHRD thought that if IIT, that quality brain can be used to give some input in medical sciences also, only then this idea was conceived, and IIT Kharagpur is now the premier medical college in country. Likewise, in the global scene, we can see in all universities, hybrid kind of courses are running. So in this present time, when we are facing this Corona, COVID time, we all are confined, and online things we are facing, we are running every day. So in this time, whatever vaccines have come, as we are reading through newspapers, again, it has come through deep research using those equipments which technology has provided to medical people. Dr. Jha's talk today will certainly give us new thought, new orientation we'll have today to see that how medicine and engineering or technology will work together and what will be the outcomes in coming days. With these words, I express my thanks again to SPSR, guest speaker Sri Rajan Jha Sahab, all faculty members, all students, Professor Vivek, Professor Deepi, and other organizers of this program. Thank you very much.
Thank you so much, sir. A little housekeeping before we get started. If you have any query during the presentation, you can either drop your question into the chat box, or you can also use the raise your hand option available in your control panel. We will bring all your queries during the questionnaire session. Additionally, a link related to feedback form and e-certificate will be shared with you all of you in the same chat box. Please fill that form to avail your e-certificate. Now, without a further ado, let's turn the time over to our presenter, Dr. Rajendra Kumar Jha, sir. So I kindly request you to start the session.
दो मिनट के लिए आनी थी फिर बंद कर दी
No, it's starting. Okay. Just let's share. Close that. Close it. Close it. This now. Close it. Double click. Slideshow. Slideshow. Okay, slightly slow. Okay. Now again, can you ask them? Can they hear you?
Can you hear me now?
Yes, sir.
Can you see the slide?
Can you see the slides also?
Yes, sir. We can see the slides.
Just go.
Right.
You can start.
Good morning, everyone. I am very thankful to the organizers of this webinar, Mr. Mishra, Mr. Chawla, and all the faculty members of this engineering college, and the organizers who have been behind this organization of this wonderful opportunity that I have got to speak to the young minds, especially the engineering students, which I am told that they are the one who are going to listen to this in large numbers, faculty members of this engineering college who may be there with us, and all my other participants who might have joined in this particular session. As you know, this is a special opportunity because of, as Dr. Chawla very and clearly said, and Mr. Mishra also, that because of this pandemic, the COVID pandemic, we have come closer to understanding how science can produce such a fast pace a vaccine by so many different sources. There are 180 such candidate vaccine manufacturers who are onto the job, and they have been able to reach to a final stage in almost 6 or 8 of them. So we are very lucky that science has given us this opportunity to understand the effect that vaccine, which normally takes 10-15 years to make, can be made within a year's time. So this has been able because of very close association with the clinical medicine and technology. This is a wonderful opportunity to understand that how vaccine could be manufactured for a virus which is entirely unknown to mankind until recently. So here we go to discuss some of those facts which associate the medical science with technology. As I am addressing to technologists, engineers in this particular session, I'm all the more excited to know their, how they think about medical science and how to, associate the medical science with technology in a better manner. As Dr. Chawla rightly said, that hybrid courses are being designed so that a very quick period of time we can find out solution for problems which may be very vexing, or a problem, the answer of which can come at a much easier or faster pace. As you know, that as Mr. Bill Gates said, that the next pandemic is not very far off. So very soon we may have another virus which may be as new as the present virus. So therefore, the collaboration between technology and the medical science in general has to be far more closer and integrated. That's the time that we are, coming to face, and therefore we should be far more integrated and we should understand each other much better in the present circumstances. Our old scriptures, Upanishad, says that Sharira Madhyam Khalu Dharma Sadhanam. Meaning is that it is the body whose well-being is the must for all duties that human body has to do. So fitness of body, keeping it fit and functioning is extremely important for all functions to be carried out. So very naturally, we have to deal with the body in a holistic manner. That means it is not just a physical body which has to be kept well, it's also the mental and even in spiritual well-being is required to make it truly functional, not just strength and the quantity of life, but also the quality of life, which is the goal of all human endeavors. We all know that technology has taken shape in different forms. In prehistoric times, we had to control fire, we had to generate fire, control fire, look for food, look for mobility, and that is how the evolution, which the Earth, as we know that science says by DNA printing and other ways to know that this Earth came 3.8 billion years back. And after that, the life in human form came around 3 to 4, present Homo sapiens form around 3 lakh years back. And the present proper human form has come in last 50,000 years back. And if you go by the anecdotal history, then probably we have been functioning in some kind of world of technology, but the actual pace of technology has started only maybe a couple of thousand years back. Our story says that, a lot of things have happened in the last maybe 300 or 400 years back. Before, say, 15th century, things were much less to happen. The last 2 to 3 years, things have moved much faster at a much greater pace. And in terms of changing pace, it is what you call in a geometric progression. A lot of other things have come, which we'll discuss at the end, which needs to be told to the next generation, that how we should carry the science in a manner which is really useful for the next generation of human beings. We'll talk about it in brief. We'd also like to remember our ancestors, Maharshi Sushruta and Acharya Chanak, who were the father of medicine and surgery. Charak was a physician who talked about different ways to treat disease process, and Sushruta was a surgeon who thought about how to use surgical principles to carry out intractable diseases with help of surgical instruments. He devised instruments. He is supposed to be the first person to have treated cataract in his own primitive way. Well, of course, but things were known at that time, and we have been learning since then. Other civilizations like Babylonian civilizations, Greek civilizations, Egyptian civilizations, all have contributed relentlessly to put us to this point of time. But definitely tools were different, information range was limited, and at many times it appears that natural destruction, natural devastations blocked the continuity of information. And that is the reason why we have gone back many times, back by thousands and thousands of years, and then we have recovered again. So that kind of phenomenon might have happened in the past, because many times we find blocks in information which are unexplainable. Hippocrates was a Greek physician, very well known, because we take Hippocratic oath. All physicians, all doctors have to take it in some modified version now. And he was a Greek physician of around 400 years before Christ. And he was an excellent human being, because he had reached to understand science of that time, at the same time, the what you call liberal science as much. And that's the reason why he could influence all sectors of human life in those times. This is the rod of Asclepius with, surrounding snakes. This is the symbol of medical science even today. And this is the symbol which says that, that medical science is a mix of good and bad, but the good outpaces or outnumbers in terms of its bad aspects. So good snakes and bad snakes will always be there. Some side effects will be there. Some disadvantage will be there, but that will be far, far less than the actual advantage. So that was the god of Asclepius, whose rod and the snakes continue to teach us that science may have certain unwanted things, but that has to be improved with each generation. And that is what the science has been telling. The present in scenario, we have got vaccine, which is, as we know, that's a new kind of vaccine. Many platforms are entirely new. Messenger RNA is, using messenger RNA for vaccine is for the first time in human domain. But at the same time, we know that this is the only way to make vaccine at a much faster pace in vitro. So that's the reason this process has to be improved. And improved in a manner so that the next pandemic we can deal much better. So this is a relentless process of scientific progress to deal with the newer challenges which the world is likely to face. In brief, I would like to tell you about how physician looks into their problem. As Dr. Chawla very rightly said, that we look for diagnosis very correctly, because unless we diagnose it is knowing the problem in entirety, in totality. That is not possible unless you follow certain system which helps you to understand how to unwind the whole complexity of disease. One of the first thing is the good history taking. We always take my postgraduates and undergraduates that you must take your history properly. History is the most important body because it talks about person as a whole. You want to know about the person. What is his age? What is his sex? What is his background? What his forefathers were? His family history, his genetic history. You want to know about his present illness, the past illnesses that he had, and all kinds of drugs and treatments that he might have undergone, or the places he might have visited. All these things help you to know that what this present problem the patient has come with. And this history taking is, all depends on how well you are oriented with the medical science. Better a physician, better is his history taking. He can pinpoint the disease many times for just by taking history, even without help of tools. And we see it every day that many diseases are found out, are diagnosed even without a single tool. And we are always correct, even if we use it. Or many times there is no tool to find out the disease as such, even today. So the history taking is the soul of medical scientific diagnostic protocol. As I was talking about history taking, and I tried to simplify it as much possible, you must know that physical examination is again a very important component of physicians' approach to ill health or patient's examination. And what is physical examination? It's very simple. What you do to a patient, you want to see the patient in totality. You see the patient, how the patient approaches you, how he enters into your room, how he greets you, how he explains his problem, and the manner he says, the manner he approaches the doctor, the manner he approaches his disease problem gives you a lot of idea of his mental status and the problem that he may be facing. He may be depressed, he may be anxious, he may be, ecstatic to say his problem, and that gives you some underlying pathology that he may be suffering from. Many times, the way the patient enters into clinician's room is enough to diagnose the case. A patient of Parkinson's disease, for example, if you can't diagnose the patient by his walk, by his gait, by his approach, his face, you are going to miss them. And this is possible only by a astute physician. When the way he enters into the room, you know that he's a patient of Parkinson's disease. There is no investigation on that, even today. No amount of imaging, no amount of neurochemistry is able to help the Parkinson's patient. We are still learning to know that what will really diagnose Parkinson's patients. And now we know that Parkinson's is not one disease. It is a spectrum of diseases. We call it Parkinson's syndrome. And therefore, the physical examination starts the way patient approaches you. And then you look at his, how it is head, neck, spine, body parts, heart, lung, abdomen, different systems that associates his body. All these parts are to be examined. What you call head, eye, ear, nose, throat, all these things are part of physical examination, where we use certain tools sometimes, and many times we don't have to use tools, just small, here and there, touching and, looking at the different parts of the body and maybe using some small tools, as you're just mentioning, you have got a stethoscope, which René Laennec, thought of having this kind of instrument way back in early 19th century, 1816, when he could think of a bell and a tube and a earpiece where the sound which is emanating from some surface can be condensed or can be accentuated so that your ear can appreciate those fine sounds which otherwise are not audible in a much better way. And there's a fast frequency sound, low frequency sound. This science of sound has told us that different kind of vibrations has a different meaning that says what kind of origin it is. Similarly, we have got laryngoscope, which gives you an idea. Small tool, very small, but it gives you a good idea of your vocal cord and adjoining structures. And at the same time, you can look into different, tonsils, etc. if you go a little up. So there are laryngoscope, ophthalmoscope, all endoscopic instruments which can go deeper and deeper and see in real eye. We may augment it. We'll talk about augmentation, as a matter of fact. So we are using those small scientific tools for the benefit of better appreciation by a physician. Many times we have to use this. We may not have these tools. So we take help of our clinical knowledge, as in case of India, for example. A lot of Indians, a lot of developing world doesn't have tools. Even in India, in villages or small places, you will not find all the tools with physicians, but he has to work under those limitations, and he has to see that he's able to give solution to the problem that patient is facing, even without sophisticated instrument. Even the small, I'm sure many places, even in India today, don't have this small instrument, and the patient will have problem anywhere, whether he's in village or a city or a big city. The problems are the same. It is only the doctors we change. Some doctor will have small tools, some will have big tools. People with small tools require more clinical experience to find out those difficult diseases. Smaller diseases they can handle, but the moment it becomes a more difficult to treat diseases, they have to send to a higher center for more sophisticated, for investigations which most small places will not have because it is not cost effective. Cost effectivity, another problem which most developing world physicians face, because they will not have the proper infrastructure where they can handle these diseases in a better manner. Even if they know it, they are handicapped. We investigate the patients. We investigate by looking at his blood picture, different investigations through blood, urine, stool, cerebrospinal fluid, and sputum and sweat, all these things which are easily available for the doctor, all can be found out very easily and be put through certain investigations so that we know what the disease is trying to speak. And we take some cues from here and there and then put all those informations together and try to decipher the language of disease in terms of medical words. Similarly, we talk about culture and sensitivity, how important it is. Many of you might have suffered from, upper respiratory infections or pneumonia or urinary tract infection, or sometimes, bacterial infections of intestinal tract, etc. They all are attacked by microorganisms. They're caused by microorganisms which produce pathological state, the disease process. And these microorganisms can be picked up in a proper, setting, in a culture tube or a petri dish, and we look into those pathogens or cells which are associated with that particular disease and look at the microscope, which is again a tool which came, very handy in last, say, 150 years or so, that we can see those small, tiny organisms in a, very large magnification, almost, lakh times or so. Now we have got electron microscopy and all kinds of atomic spectroscopy, which can look into at a very, nanoparticle size structures. Now we have got crystallography, which can see the structure in 3D, and we can make a picture of it. So a lot of things have gone into it, and we'll talk about it in small in the next few slides. We've got immunological studies. I think all of us are understanding this immunological, investigations are in a much better manner, because what happens? Any bacteria or organism, as in case of this, this COVID, the moment this virus attacks your body, it leaves some footprint there. Those footprints are some antigenic substance in the form of protein or polysaccharides. They form a kind of antibody within the body. Either you pick up those antigens, which are picked up at the earlier stage of the disease, or maybe antibodies, which is a reaction of the antigen to the antibody. And picking up antibody, we have got rapid antigenic tests in case of malaria, in case of scores of diseases, which can give you an early detection of these diseases, which is viral, bacterial, or protozoal. So these antigens are very helpful in picking up the disease as such. Once we know that what is the nature of disease, we can have a complementary antibodies in our labs, which can pick up those antigens. And now we have got a monoclonal antibodies, which are far more specific for the small part of that organism. And that is how we can be far more surer in our diagnosis. So nowadays, immunological investigations come as a very important tool in our understanding of the disease process. We all know about these investigations in our day-to-day life. We have got X-rays, which you know that Röntgen, that German scientist who thought of X-rays by accident, as a matter of fact. Well, of course, as you know, that only learned mind or educated mind can see these things. So he was a brilliant scientist himself, but he could see those X-rays, existence of that X-rays in a very funny manner. We know about the history of that. So is a CT scan, which uses X-rays in a different algorithmic way. And now we know that CT scan is so useful. It can go deeper inside our body and take a picture of it, even without really going inside. So when it came for the first time, when the CT scan was first found out, it was in a very crude stage. When we started our career, it was in a very, very crude stage, but it was very difficult to understand that even without dissecting the person, even without peeping into the structure of the body, you could see a correct, structure of the true state of that body in a different stages of disease. So that was a huge change which took place in the early part of this late part of 20th century. Then came MRI, which again talks about magnetic resonance. Under a magnetic field, you give certain radio frequency pulses, and whatever you get the echoes from that is in algorithmic fashion, in a different permutation and combinations. We make different algorithm, which is indicative of particular kind of tissue state, in physiological state, that means normal state, and in different disease processes. MRI gives you a very true account, very clear account of much more clearer, especially in the case of soft tissues, where the CT scan fails. CT scan is much more useful when the structures are with a high coefficient, in the sense they have got what you call more like calcium containing tissues, where the X-rays give you much better picture, whereas MRI gives you all tissues irrespective of its calcium content or specificity. So that was the advantage. So is the PET, so is the SPECT. So a lot of these investigations have come in the form of imaging that gives you the idea of better understanding of pathological process. Initially, it was anatomical structures that we were trying to know. But now we know, with the help of these newer investigation tools, where we are trying to know even the microscopic details of each tissues with the help of imaging. The time has come when we have got, this 3D picture. We'll talk about it. 3D picture of a body and different, genetic tools which can make you a structure which is so, easy to understand, easy to make. For example, if you want to make a bone, say a long bone, which is, say, in case of our long bone, femur is longest bone, we know that we can make a true size of the long bone with the help of 3D printing. And we have got MRI and CT scan, which gives you the idea, and put in a 3D mold, we are in a position to give a true picture, true three-dimensional picture of that particular bone. And if you want to make that bone, artificial bone, it will be truly the correct size. There will be no mismatch in that. So earlier, we were not having all these facilities, but now we are using these things in a manner which doesn't allow any wastage. Now we are far more surer. Suppose you want to make a lens of the eye. You can make lens of eye which is suitable to your eye aperture or the size, which was not there before. Now we can, print in a real time, in real space, which was not possible earlier. So this imaging techniques, with help of newer emerging, techniques, technology, which has come already, which is in fact coming at a faster pace with some improvement. So those are the areas we'll just talk about in brief in future, in coming few slides, and we'll talk about it in the next few slides. Now look at this. What has happened when I started my career some 40 years back as a first-year resident? One of the first patients which came to me was a patient who came in shock. He was a child, 2-year-old child, still remember, 2-year-old child. I was posted in pediatric emergency. And after just a few days of, mingling with the child patients, I got a call to attend a child who was in shock. And I was supposed to treat that patient at a short notice. I found the patient was gasping. There was no pulse. Patient was cold and clammy. He was in shock stage, what we call it. Urine output was nil. And I was supposed to give that treatment within fraction of minutes, which was not possible to investigate even. Any investigation will take more time. But with the help of clinical understanding of the problem that he was having, that he had a cholera kind of, most likely some kind of gastroenteritis, or maybe cholera, we don't know, looked like cholera, which was endemic in some of those areas. And then we had to give fluid containing salt. That was the requirement. More so, the fluid was extremely important to given at a very short notice. What we had to do, put a needle, again, as the technology, wonder. That small needle was to be inserted, and the small needle with a tube and a bottle of fluid containing sodium chloride. That is all was needed in this case, isotonic sodium chloride, 0.9%, what you call it. And that was to be given inside his vein. That was given to him at a very fast pace. We had no, at that time, sensors which normally regulate the number of drops that per minute that we normally count and find out how much blood, what speed one has to be given that. So there is now we have got a lot of algorithm understanding. In those days, we were counting drops per minute as a rate at which we have to give. And the first few, first 2 bottles have to be given at a faster rate, then slowly we reduce the dose. So that is what the understanding was. There is not much of understanding in terms of how much fluid has to be given at what pace. But fluid has to be given at a faster pace in as few minutes, as soon as possible. And that was done in that case. And I was lucky, the patient was lucky as much. And we got a good result. Patient could be revived and he could go. So what I want to say, that diagnosis apart, the technology has given us tools from the very beginning, as Dr. Chawla and Mr. Mishra very rightly said, that science is integral part of human evolution. We know that human being has come last 2-3 lakh years back only. The plants came almost 3.7 lakh years back. There was no plant on the earth. So what I want to say that evolution has given us tools also, and we have modified the tools to our advantage in years to come. And that process continues even today, and that will continue even in the future years to come. But at this juncture of century, we are at a time when we're getting millions of papers, lakhs of informations that has to be regulated. Regulation has become very important. Pick and choose has become very important. So whereas this modern ways, as I will speak after some time, if time permits. So let's talk about the landmark, post NASA. We had a lot of things started happening in very quick succession. This may be because of we have become wiser. Maybe a lot of informations have gathered at one point of time where we are receiving, a kind of chain of informations which are integrating to each other and trying to generate more information. Now look at this. Penicillin came 1929. We had no set of antibiotic before that. Fleming, Florey chain in somewhere in 40s. So tissue culture came in 49. Chlorpromazine, the very important psychopharmacology, we deal with very frequently in actual clinical situation where the patient, for no reason, develops irrational behavior. Schizophrenia, manic depressive, or neurogenic, state, etc. This drug, chlorpromazine, opened the gate of more and more information that psychopharmacology situation. We can treat almost all the psychiatric cases in a much better manner. We had no more asylums that used to be in our time, in those times. Asylum has ceased to exist. Tuberculosis, asylums where tuberculosis was treated with only good food and good air, etc. Now we've got drugs which can treat, we know that the organisms, tuberculosis, acid-fast bacillus, which is responsible for tuberculosis. Now we know about that. We have got a treatment. 1946, as late as 1946, streptomycin came to its existence from the soil bacteria. And that streptomycin gave us the first drug against tuberculosis. Now we have got a whole lot of drugs, and now we've got a whole lot of newer kind of mycobacteria that we have understood. This acid-fast bacteria leading to tuberculosis. Now we have got multiple drug-resistant tuberculosis, and now we have got extended drug-resistant tuberculosis, which is not available to all the drugs. If we don't have clue to this kind of disease, we are keeping those patients in a very secluded environment so that they don't spread that disease. The time has come. Research is failing in that particular direction. Now scientists have to go and find out how to treat such people. We are clueless at this point of time to treat a segment, very small segment at this point of time, who are untreatable tuberculosis. So there is always a fight between organism and the treatment that we offer. It is a relentless process. It is an unending process. And this a process which gives you a lot of impetus to think new things and think differently. Many times science has come at a stop at a particular point. Some other direction has given entry to a clogged point, and the science has moved again. Moves. Many times science has not moved for years together. The scientists have failed. Some strange coincidence given a clue to a particular drug, which has opened the gateway to much complex problem. And many times, as Dr. Mishra said, that nature has given the clue. Most of the time, it is the nature which has given this clue. But understanding nature's language has been a problem. Many times, the botanist, many times zoologist, many times, alternative medicines. They've given us some idea that this can be an answer to a particular problem. So no other direction is useless, so to say. We must keep our eyes and ears open and brain open, so to say, and appreciate whatever they are trying to say. Most of things will be rubbish, that I know. But there will be few such things sometimes which will give you a new idea for the science to unlock that particular block. And this has been happening since long. It will happen even in future. So this is very important for the young minds to know that don't close your brain, but always think that you may be trapped if you follow most of those things. So you have to always check and balance your information gateway. So we're talking about, this 1953, Watson, Crick, and Wilkins found the structure of DNA, for which he got the Nobel Prize. They got the Nobel Prize in 1962. This was the first, solid information about structure of DNA and this DNA as a chemical basis of human genomics or genes or human characters. This immunology, the HLA typing, about which we are now boasting about, this tissue transplantation of different types. There is no transplantation is possible unless you use HLA typing, without which the whole new information range about, suitability of a particular organ to a particular person, a lot more depends on this, leukocyte antigen, which are histocompatibility deciding factor, which was found out by Jean Dusant, for which he got Nobel Prize in 1958. I will not like to, I don't want to forget the contribution which was made by Dilip Mahalanobis, who didn't got a Nobel Prize for sure, but he gave us a clue how to treat millions of, poverty-stricken children of developing world who were dying of cholera because of, we had no control because of poor hygiene, but the child was dying for want of fluid there. And the fluid that consisted, besides sodium chloride and water as we normally give, and a couple of other electrolytes, also a little bit of glucose, which can penetrate and facilitate the entry of fluid inside the tissue or the body, inside the blood vessel, so to say. So if you drink water, make child drink, especially in the early stage, where the shock stage comes, where one can drink water without vomiting it out, then probably it is high time you start giving ORS solutions, oral rehydration solutions, in which little bit of sugar mixing was his main contribution, for which he got awards, number of them, but not really a Nobel Prize, which he very much deserved because his work had helped millions of people to survive. In Bangladesh during 71 war, I remember when we were young minds then, we had seen the children, large number, were dying because of cholera. And that Vibrio cholerae, the organism which has changed, as we are finding in case of corona. So that Vibrio had changed its antigenic type and it was not amenable to therapy. Fluid was the answer, and fluid giving orally is far more easy and a proper. And what was supported by Dilip Mahalanobis research in Calcutta, which made it ORS solution to be possible, and therefore the mortality, which was 30% during those days, came down to 1% within 1 year. So that was the contribution which our people made. I would like to not to forget to mention Henry Ford, who contributed hugely against the tobacco lobby to stop smoking and make people understand that smoking is harmful for the body and harmful for the mind, body, and it is a kind of stimulant for not only cancers, but our immune system to get weakened. So that was, in a nutshell, a couple of landmark things which happened in the 20th century as a whole. Now, I have been contributing in different magazines and daily newspapers. I've been writing about public health issues, and there I could, pick up some Nobel Prizes which contributed hugely to understanding in last century or maybe last 20 or 30 years. In fact, Nobel Prize came into existence. The first Nobel Prize of Medicine started in 1901, and after that, year after year, some real good contribution in the health of medical science, which we call physiology or medicine, the Nobel Prize is known, is given to the what you call seminal contribution made by the scientist or group of scientists in a field. Every year it is given, except for maybe around 7-8 years, and because World War, it was not given. Otherwise, it had been being given almost every year. And some newer things are, we are learning. 2010, for example, I just quote the last couple of years. Just for example, in vitro fertilization. Now look at the misery of those ladies who were not able to conceive, especially in olden days. Now things have changed much faster and much better. But in those days, not being able to, conceive was a huge, as if it was a punishment to the ladies most so, unfortunately. But those things, those are better understanding has helped us. But definitely in vitro fertilization was a huge landmark, I will say technological revolution, where better understanding of play of hormones in a maturation of follicles, the ovarian follicles which form oocyte, the female gamete, and the role of hormones and structural dysfunction, which is responsible for the ova not to reach or meet sperm, which is entering into through the uterus to the fallopian tube, where it has to stay for 2 to 5 days, where zygote is formed, and zygote then descends in a mature way, where the maturation keeps taking place from 2-cell to 8-cell stage, which is the implantable stage for maturity of the zygote to be able to catch lodged into uterine endometrium. So that kind of understanding was not there before. It came only in 70s, I will say, which was recognized much later in 2010, that these are the factors which are responsible. At that time, it was so difficult to really operate on a person, take out the follicles, and then put it in a petri dish, make it grow, and then put it back to the uterus. That is what this Robert Edward did. But he had the help of Steptoe, which could not be given this Nobel Prize because that gentleman died before the Nobel Prize could be given. So that is, I would like to say that at each stage, there has been a revolutionary changes, which technology and understanding of problems, which medical science had the capability to, participate with technology and help the problem to be solved. This is Louis Brown, the first child which is born out of in vitro fertilization, which is now a grandmother now. She's the grandmother now. It lasts as many years. It was in 1972 or something that she was born, 71. Now she must be around, and she has now just become grandmother. So what they were not able to, find a life without this kind of research. So these research have gone a long way in making us understand how technology integrates with medical science. Unless you know about the biology of the body, unless you know about the requirement in terms of technological input, you will not be able to solve the problem. So integration is very important, as Dr. Chawla and Mr. Mishra said, that this integration is possible only by interacting more frequently. We doctors are somehow, at least maybe future doctors will be better. There's no training of mathematics. We want to know modeling. We want to know a lot of statistical methods, which are not given enough, importance to medical curriculum. Otherwise, we can't analyze data the manner we want to our satisfaction. So many times we have to seek help of a statistics person who doesn't understand medicine so well. The modeling will be defective. The modeling is defective, your for example, in vaccine preparation, we don't have good data. We are not happy with the data. The science world, I mean, the medical science world, or those who are in the making of vaccines, the technologists and the physicians together, they don't understand statistics, the kind of survey that they should be doing. But there, they will give us a model. We have to subject those vaccines to those people and find their output. And, relay the information for the future. This, immunity, this 2011 information by Butler, Hoffman, and Steinman give us idea of adaptive and innate immunity. We have been talking about a lot in the last couple of months, that innate immunity, the immunity which is the first line defense of a body, which is irrespective of which virus is coming, which bacteria is coming. This ingrained in our system, that is known as innate immunity, largely macrophages and eosinophils, etc. These are the cells and some of the specialized cells which come into picture to handle these things, which are wandering cells, all the time moving in our system to catch hold of any aberrations in the body. So this is innate immunity. And there is adaptive immunity, where body adapts to a particular situation. This situation dependent. It is dependent on specific stimulation of certain factors, which you call here the T cell. T cell dependent. T cell also operates in subsequent innate, defense also. But primarily, adaptive immunity is T cell dependent, which depends on the dendritic cells, about which Mr. Steinman, Ralph Steinman, found out those dendritic cells, the cells with dendrites, with different tentacles. These cells he found out for the first time while looking into this kind of problems. When immunological challenges were met, they found that this kind of cells do appear, and these stimulate our whole gamut of adaptive immunization, adaptive immunity, and therefore it gives you long-standing immune protection to your body to varieties of substances, viruses of thousands of times, bacteria. We don't know how the world of, as Mr. Mishra rightly said, that it is the whole world is a kind of interdependence. We live in a kind of coexistence, equilibrium, where there is a food cycle chain where somebody eats somebody's body, and then somebody eats somebody's body, and that is how independence, plant, animal, all coexist in a stable manner. The moment the stability is disturbed, there is some kind of change in the equation, and the equation may go against you, against human being. Insects are far more in greater number than what we are in human beings. They may be a little larger with forehead, the forebrain, which makes us different from chimpanzee and our, forefathers. So you may be intelligent, all right, but they are large number. They have also to adjust. They are also in the process of evolution. So it's a kind of chain, a cycle. So at this point of time, in terms of human beings or human civilization, this is extremely important to understand that there is a coexistence, and you want to, go one up, you have to be always cautious and guard your existence. Just try to talk for a minute about the reprogramming of cells, what we call the stem cell research, which was taken out by Yamanaka, the Japanese orthopedic surgeons turned a scientist in truest sense, because he found out the cells can be programmed to become pluripotent or omnipotent cells. They can go back in the evolution, go back in the growth cycle, back to where it was. A matured skin cell, which is already differentiated, can become the embryonic cell. And it can again be made to grow into cardiac cell, or intestinal cell, or a lung cell, or a different part of the body. So any cell of the body can be made to move to another part of the organ. He could show that his team, so to say, one included Mr. Srivastava, who's from India, is Indian origin scientist, who has made heart from the skin cells. It is possible. The pumping heart can be made out of skin cells. And this is happening in the real time, in the real world. So time has come, we'll have no dearth of organs in for transplantation. Organs can be made de novo. The body, any part of the body, be it muscle or a bone or an eye or a lung, anything can be made out of anything. The only thing is we are just finding out few proteins which are responsible for its differentiation. If differentiated cells are given those four important, now we have found out just 4 proteins. If given to the skin cell, it will go back to pluripotent cells. And so go back to a stage where you can change into some other line, other cell line. So this is possible. This is a huge, huge change in understanding of, organ making or, what you call stem cell research. Earlier we had embryonic stem cell, embryonic tissues, which are present even in adult, in bone marrow, and maybe a small amount of the blood, is also can be made de novo, can be made in vitro, so to say, in laboratory conditions. And this will give a huge, huge impact in future medicine. This is a Nobel Prize, which was won by them in 2012, has made a lot of flutter in the whole scientific world. This is Shinya Yamanaka, very simple man, brilliant in his approach, very simple. And Gordon is the father of this research. We'll talk about, I think I can go one by one, but it will take a little more time. How much time I have? No. So this, I think I can go a little faster. Understanding a brain has been very challenging for the medical science. This is one area where the science and technology are all failing at this point of time. Maybe computer is one which is helping us to understand far better. This computer sort of interface of the understanding, creating data, creating the structure which looks like a brain, which looks like much like our brain, the way brain functions, has given us some special understanding. GPS, where we are located. For example, I am at this point of time, say in Ranchi. How my brain knows that I am at Ranchi. I am doing this particular work. I am moving my body in a particular fashion. This positioning, I will say, the appreciation of position was for the first time discovered in real sense by these wonderful people, John O'Keefe and May Britt Moser, who found out that locate special cells. They were behaving in a very special manner because there was a possibility by science again, by technology again, to implant those electrodes in our brain, cortical surfaces, as we do in EEG, which I did not mention earlier, electroencephalogram. Now we have a corticogram on a cortical surface, a brain, open brain surfaces. Put a needle there and find out what is happening in electrical, changes, and that gives idea where the activity is taking place. So this kind, he found out that there is an area and there is a cell in the hippocampus, the posterior hippocampus, where there is a place cells and there is a border cells and there is a head cells. So all those cells were found out by mapping them and by, and they're real life cells. They are not imaginary cells, not just, they're different looking cells. It was found out by deeper investigations that these cells, they behave differently and they have some special purpose. And they are GPS cells. They gives you global positioning. As our car, when we move, car tells you you're going to Chhattisgarh, this is the direction. Similarly, our brain tells you this you are located, you want to go to Chhattisgarh, this is the way to go, and this is how our body will go. We can retrieve again. So this is a hippocampal organization, and there is entorhinal cortex just behind it. And that cortex, this keeps a long-term memory of positional system. We want to retrieve, how did I come from Ranchi to Raipur, for example? Our brain can, keep those informations in a solid form, in a compact, proper form. And the moment we want to retrieve that information, the kind of retrieval systems comes into play. And we remember that that was the way we came and that is the way we move. Even your movement, your deceleration or acceleration can be picked up by some of those cells. And this was possible to know only recently, for which they were rewarded very rightfully by giving us much better idea how memory takes place, how a memory is organized, how memory is retrieved. We knew a couple of definitely it was a leap, in time while they found out this positioning system. I think I would like to talk about one very funny, contribution made by these wonderful scientists, William Campbell and Satoshi Omura, which ivermectin you must have heard recently in COVID treatment. Ivermectin is one molecule which came into prominence some 20 years back when it was found very useful as a treatment for parasites. Well, of course, they got Nobel Prize only recently, 2015, but this molecule was found out with the help of this genius, Satoshi Omura, while he was looking into the soil specimens. And they found out one specific type of soil bacteria which were behaving differently from other bacteria. He took help of the brilliant Campbell, who was working for MSD, the famous pharmaceutical company. He was the pharmacologist of that particular company. So there was arrangement between these, Kyoto University and MSD, and he sent the samples to Campbell. Campbell, wanted to know the response of different diseases for this ivermectin, and he could see that he was able to treat those difficult parasites for the veterinarians initially, especially for the horses. He worked in Australia, and he found out a lot of horses there. So he used those molecule against those parasites which horses carry, and instantly he found initially in mice, but later on in horses, that these are very helpful anti-parasitic agents. How they act at that time we did not know, but now we know that they paralyze the neuromuscular apparatus of those parasites, even in a very small dose, what is once 50 to 70 microgram per kilogram body weight. At that particular dose, they're able to paralyze the neuromuscular apparatus of those animals, small, including lice, which many poverty-stricken people have, maybe ascariasis and filariasis above all. We have areas even in Jharkhand, near Bokaro, where people suffer from elephantiasis, in Bihar, in whole of UP, all over India, so to say, even the coastal Andhra Pradesh, Odisha, I'm sure even in Chhattisgarh. So filariasis, what you call hydrocele, people have hydrocele, and hydrocele is that's the only important cause, most important cause of hydrocele is this filariasis, the microfilaria, which gets lost into those, vaginal, which conducts that, takes out that lymphatic fluid to the lymph nodes. That lymph is blocked, lymph node is blocked, lymphatic tissue is destroyed, and therefore the fluid lymphatic secretion takes place in that tunica vaginalis, the covering of testes, and there the fluid gets collected, and there is a hydrocele. Most surgeons used to, make huge amount of money by operating on these hydroceles, especially at a very, small levels. And that surgery now becoming less and less because that disease had disappeared from the earth almost with the help of these ivermectin. River blindness. We have not seen river blindness, the disease of, Southern America and Africa, where this was endemic. People used to lose their eyesight because those microfilaria used to block the lymphatics of the eyes, and therefore the structure was, especially the iris, was destroyed, and therefore cornea was clouded, and therefore they used to prematurely blind at the age of 20, 25, 30, 35, they used to become blind. And this blindness, the cause was that those microfilaria, a specific type, which grew unlike microfilaria, which is a little different. Here it is eye was involved, and those that black fly, as they call it, as a the insect which to carry that microfilaria was grown in very large number in those Amazon and large flowing rivers of dense forest of Africa. And those populations used to suffer from this incurable blindness. Now doesn't exist with help of this drug. So the blindness of Africa, South America, and part of Arab world has gone. Now people are no more. Otherwise, it was a very common scene to see 4 or 5 people of his family being held by a young man who has not developed yet loss of eyesight with help of one stick, all holding together one stick, 4 or 5 family members, and they used to cover distances. Those curse has disappeared with the help of this wonderful, a very simple organism found out from a soil of a golf playground there in Tokyo, Kyoto, where this gentleman Satoshi Umura was a researcher, and he found out those soil bacteria which producing ivermectin. Later on, he found out dihydro derivative chemical structure was found out, and derivative was far more easy to use, and therefore the whole generation has now become full of eyes and brain, so to say, in future. So was 2UU, who discovered a therapy against malaria, the resistant malignant malaria, which was a killer malaria. Until recently, when I was young, I used to see that scores of people dying of malaria. I have seen with my own eyes that we had nothing to cure, nothing to give them. They will come, they present with fever, maybe convulsion, maybe loss of consciousness, lying on the mattress in the ward in numbers. They had no bed because there were so many numbers. It took place when Jharkhand was and Chhattisgarh was information. We were, consultants at those times and seeing these patients, and they used to, die in front of our eyes because drugs were not effective. It was quinine-resistant malaria. Chloroquine was not working, quinine was not working, and we had no way to help them. And people used to die within hours, with not even days. I got one, I remember a commandant of a CRPF who was posted in Assam. He was from Gaya. He happened to cross through, some part of Jharkhand, where he got down, maybe in Muri, if I remember. He traveled to Ranchi and got admitted in my unit. It was dead in night, 2 o'clock. I was woke up. I was told that one serious police officer is in danger of life and please come. I went immediately there. I found he was dying. Fortunately, this 2UU discovered drug, which was responsible artemisinin compound, which was a boon of Chinese culture, I must say, because they had found out this, wormwood, silk wormwood, the plant, which was a ancient Chinese texts had given this information, but they didn't know how to use this particular, wormwood. And 2U, she rightly so, she was not a doctor, not even a PhD. She was a, pharmacology trained person who had exposure to ancient Chinese texts. she found out that particular, scripture, because he believed that there is some kind of treatment for this kind of fever. And she looked into it, and she was asked by no less than Mao Zedong, because they were losing the war against Americans in Vietnam. Ho Chi Minh told Mao that please find out some cure for this disease. And Mao urgently called a meeting of his scientists and said that who can find answer who is the exposure of ancient Chinese texts in the modern science. In fact, he gave a template, Mao, that yes, you must have somebody who can understand both the science better. And he knew that some treatment exists of intermittent fever. And he interested this lady, Tu Yu, so a 39-year-old lady, who was entrusted with a P536, 564. That's the name of the project, which was given to her, and she led that at a very young age, and she found out in 7 years the answer to the next problem. Well, of course, lakhs of people died in southern part of China, southeastern part of China. It was endemic to have resistant malaria and people dying. And so she could find out that, yes, there is a therapy. The extraction method is different. She did a cold and ether extraction of that silkworm wood material, which turned out to be artemisinin compound. Structure was found out. Again, its chemical structure revised, and a more potent molecule came out for our use. And slowly, because that time China was a very secret and very secluded country, she could not get much deserved Nobel Prize then. She got in 2015 because the world came to know much later. She could present her, article at a very late stage, and Chinese medicine was lagging behind in all spheres. But then in the last 20, 25 years, they have gone much faster, no doubt about it. So at that time, she's the first Nobel Prize given to a lady, and that to a medical scientist. Physics, chemistry, mathematics, economics, they had no Nobel Prize before that. And therefore, she became the first Nobel Prize winner, that to a lady, that to a non-doctor, that to a non-PhD, no training. She gets a Nobel Prize, the first Nobel Prize in American Chinese history. So that is the wonderful story of Tu Yu, who found out this wonderful drug. Then there is a very interesting story of autophagy. You must be knowing about it. Our culture has been pleading for us to go for fasting. We call it religious fasting. The idea is, if you keep fasting for a certain number of years, your process of energy development changes in fasting. Initially, it is glucose dependent. Glycolytic pathway takes care of glucose production. That lasts for only 15, 16 hours. After that, our other body tissues come into play. And their important structure, which are formed by protein and fat, they are the ones which getting destroyed and making energy for us. This kind of reverse cycle of body tissues come into play if you go for fasting for long. Autophagosomes are produced and they are processed in our cell. There is a kind of phagocytosis which takes place at the cellular level. And this phagocytosis is carried out by these phagocytes known as phagosomes. And these autophagosomes are responsible for the clearing those dead and non-functional proteins and cellular structures. And this autophagy, if made into activation mode, given that kind of stimulus to go, it clears many or other non-functional, non-useful substances, including different toxins body produces, different viruses they are attacked, different bacteria to which we are attacked or exposed. So this fasting, which augment the process of autophagy, has found a scientific basis, for which this Yoshinori Hosumi got Nobel Prize in 2016, which I think somehow gives us some stimulus, some food for thought that fasting is not altogether bad. what most people think. Then there is another research paper which came about circadian rhythm, jet lag, phase changes, your duty roster changes, morning, evening, evening, morning, afternoon, that kind of changes. How our body, resumes that activity, this at molecular level. This was, cleared by these wonderful scientists, Rosbach and Michael Young, by finding out the molecular mechanism. What makes these, shifts take place? Surprisingly, even I didn't believe so, but this, circadian cycle is ingrained in our system. It cannot be easily altered. In fact, it is almost impossible to alter beyond a point. If you alter it, you will have a backlash kind of thing. So you have to accept it. Now, this alteration, he found out, in fact, he saw that when these, sunflower, for example, sunflower is a very wrong example, but a couple of flowers which bloom in the morning and, they close at evening. If they are changed to evening to morning, still they maintain the same time clock. They don't change. So this is a huge change in understanding of, time shift or circadian rhythm. So he found out molecular which are ingrained in our genes responsible for the circadian rhythm. And if you can alter those molecules, we can change our scientific, the circadian cycle of each one. And therefore, very soon we'll find two genetic products which help us to appreciate day or a night or a time of the day and change our requirement accordingly. The time is not very far off. We'll have drugs which will make you sleep in the daytime and wake up in the night, or vice versa, as the requirement may be. So this is a huge leap for which 2017 Nobel Prize was shared. These are the gentlemen who contributed, and this shows at what time we are alert, at what time blood pressure is more. All these things are monitored at the molecular levels, governed by certain genes, about which we can discuss some later time. 18 Nobel Prize went to cancer therapy, where we knew about cancer treatment. Cancer, as you know, is a plague of the present era. We don't have very clear-cut answer why it originates. Almost, they say that almost 1/3 of cancer is totally unknown. We do not know. 2/3 is known. 1/3 we have an answer. 1/3 we are partially answering the problem, but 1/3 we don't have any clue at all. So we are finding a clue now with the help of this discovery of immunotherapy, immunoregulation of cancer cells. Now we can use our own immune checkpoint molecules, what they call it. They're proteins embedded in our lymphocytes, which target the target cells. So we can inhibit those checkpoints, which augment the growth of cancer cells, then we can stop the cancer cells and use our own immune cells, which are working as the cancer cells. Cancer cells are, foreign, so to say, because they have a different genetic makeup. So those cancer cells can be attacked with the help of our own immune system by the checkpoint inhibitors. Now we have found out, we have the molecules. In fact, every day you'll find some news about such checkpoint. So immunotherapy has joined chemotherapy as a joint therapy besides surgery, surgical oncology, or radiotherapy, or radiation oncology. So now we have got more ways to look at cancer therapy, which is new, entry to this kind of molecules for the cure of cancer. And this cancer is now, Jimmy Carter, he suffered from, metastatic malignant melanoma. It was only in 2018 he was treated with this, checkpoint inhibitors, P18 most likely. So he was given this molecule, and his third phase, he was a 98-year-old person, but he was fit and fine then. he developed this malignant melanoma in a metastatic phase. Already brain was involved there in that case. He was cured completely by repeated scanning and other invasive and non-invasive methods, that there is no cancer cells exist with the help of these checkpoint inhibitors. This is a huge leap in understanding of cancer in recent days. And these gentlemen, Tasuku Honja and Ellison, were responsible for the molecule called checkpoint inhibitors, which has come in a big way, and we have understood how to go about using these molecules. It will be a little off place, but let me tell you that we didn't know much about how to, adapt our system of oxygen deficiency state. Suppose we go to a place, say we go to Leh, we are fighting Chinese at Leh border, is it not? So there is a deployment of thousands of Indian soldiers there. They are facing one of the biggest problem in dealing with that kind of altitude is altitude-related, body dysfunction. You produce pulmonary edema in such patients if they are not acclimatized properly, because oxygen delivery system fails there. And they found out that what is the molecular mechanism to adapt oxygen availability. If you add those molecules, even at a very high altitude, very difficult situation where it is impossible, space, we are going to space now in coming years. One of the major problems will be to overcome the G, and G is related to oxygen availability. So we can have molecules which can make life much simpler living in very high altitude situations. So I think we'll not talk much. There is a huge science involvement in it, very simple to understand though, but I think it will be, just introduction. So I'm not talking about, so this is the conditions, anemia, cancers, everywhere there is an oxygen mismatch there. In anemia, hemoglobin is not able to carry enough oxygen. Cancer cells are using more oxygen, or they are growing even without oxygen. So stroke, infection, wound healing, everywhere there is a tissue oxygenation which comes into play. And we can govern now tissue oxygenation by altering the oxygen environment with the help of molecular changes that we have come to know. One very important, I think extremely important, this is 2020 Nobel Prize went to hepatitis C virus. This Michael Houghton Harvey, they jointly got this Nobel Prize. This was a virus responsible for cirrhosis of liver. In our time, cirrhosis of liver meant alcohol. Slowly we found out, no, it is hepatitis B. We knew it's blood-borne hepatitis B which is responsible for it. But these two gentlemen found out hepatitis B was only 10% of blood-borne viruses. The 90% was hepatitis C. And that was not to be screened then, because we had no way to know what is it hepatitis C. And we could know that, yes, who is monitoring? Hello. How much time I have?
Hello. Yes, sir.
How
Sir,
much time?
actually, it is about to close, sir. We are running short of time, so.
I'll just close in 5 minutes.
Yes, sir. Yes. Okay.
So the future is the future of medical science, as you can see, is personalized precision medicine. This personalized precision medicine means we were all these years we were looking for a community-oriented medicine, population-based statistics and medicine. Now the time has come when we are looking for a holistic approach to individual, where his whole genome is studied. You have got genomic study, Human Genome Project in 2013, we found out total structural analysis of genetic background of each human being. And therefore we can alter the genes to make it, repair the genes, make a newer genes, make a newer cells, which is suitable for that person. And we have the advantage of using augmented artificial intelligence and computer interface, which give us plethora of information. You can use them. So you have got information which can be integrated with the modern science and which is individualized. Many reactions take place because our genes are different from the other genes. Some odd genes can make our body to react. We are going to take vaccine. We know that vaccines will become useless to a couple of people. We know that. They will create reactions. We know that. But the science has to give an answer in terms of, say, 90-95%. That's a problem. So science has to be personalized, precision, and honesty. Thank you very much.
Thank you so much, sir, for a factual, well-organized, and exceedingly interesting presentation. Before moving ahead to the question answer session, let me remind you again that you can ask your questions either through the chat box or raise your hand option available in your control panel. If you want, you can also directly interact with Rajendra sir. Sir, we have a question in the chat box regarding Dr. Hargovind Khurana. It is from Ayush Divakar, he wants to know why Dr. Hargovind Khurana is not able to get the Nobel Prize for his prestigious work in genetics.
He got the Nobel Prize. But somehow he was not the first one who found out the structure of our genes. So he definitely found a Nobel Prize. Who said no? Yes.
Thank you, sir. There is another question by Dr. Anjali. She wants to know, sir, there is any suggestion as person from medicine field where technology or specifically imaging technology can play a role in diagnosis of mental health, which is next threat due to disease like COVID-19?
It's a very good question. I must compliment. Actually, mental health has been a huge issue, as I told you, that very recently, somewhere in late 20th century, we got a lot of attention on mental health. It was not being addressed properly. Not many drugs. Now we know that there are part of the brain which behave differently in psychiatric illnesses. You have got an area, as I just mentioned, hippocampus, and the whole gamut around hippocampus, entorhinal cortex, and all those structures, and even a parietal lobe, they play a very important role in initiation as well as continuance of psychiatric diseases. Now we have got, as I just mentioned, PET scan and SPECT, which analyzes the neurons in a differently metabolic form. There are functional MRI, which picks up the anatomical structure and looks at the activity, the functional activity in terms of electrical and biochemical both, which can give you an idea the changes are taking place this point of time at this kind of changes, and therefore they can be utilized to diagnose. But at this point of time, they are not a very specific answer in diagnosis of psychiatric illness.
Thank you so much, sir. Dr. Anil Kumar Sinha sir, he has raised his hand. Sir, do you have any question? Dr. Anil Kumar Sinha sir. Sir, you have to unmute yourself. Yes, sir.
Am I audible?
Yes, sir, you are quite audible now.
Okay, thank you much. Thank you very much to Professor R.K. Jha for his excellent discourse. And personalized precision medicine is the next very interesting phase of the medical science. And of course, we got very good molecules like ivermectin that is very helpful to us as surgeons in treating lymphedema due to microfilariasis. Previously, we were not that alcarbamazine was not very much useful. The artemisinin that is invented in China and a lady, but we have observed that in North India we have found that the plant of Harsingar, also called Parijat or harshimar that blooms in the October season, and people are using the bark and leaves of this plant and for this malarial fever. I don't know whether it is the same thing or this is another species of Chinese herb, but one should try to explore it also in our country because we have not been able to explore our so many herbal assets that has been found and observed and discovered by other people. So thank you very much, Professor Jha, for this very excellent discourse that overlaps the very various disciplines of medicine, immunology, neurology, surgery, and reproductive medicine, and all. So, and the GPS cells of the brain of the hippocampus, of course, it was a new information for me also. And thank you very much. Thanks a lot.
Thank you, Dr. Sinha. Actually, I'm sure there are many drugs hidden in the plants, and they have to be found out by the kind of collaboration between pharmacologists, botanists, maybe Ayurvedic people who are using these herbs in a better way, and the modern science, technology as such, to find out answer to many of these problems. I'm sure there is a future for it.
That is the disappointing fact that the importance of autophagy that is researched by the Japanese doctor, but in our religion it has been very much stressed the importance of fasting on the various occasions, and we ourselves couldn't discover due to so many reasons because we're still developing countries, but we need to concentrate our people and of course to advance in scientific medicine, not only clinical medicine. Okay, thank you very much.
Thank you, sir. One student wants to ask something. Sir, I want to know about bird flu. So,
yeah, this is emerging problem. Actually, we had in the past also the avian influenza, which is brought by this bird flu. There's the two component of it, H1N1 as you call it, the different forms of it. There are two antigens. There is one hemagglutinin and neuraminidase. There are two H and N, two component. The different varieties of H1N1, H2N2, H7, 8, 9, 10, something like that, and the same way. So different variants of it. Each time there will be some different one. So they keep on changing, and depending on that, we have got a vaccine. We had a vaccine against this some time back, but I'm sure that we'll have vaccine again. But till such time they found out the genetic component of these viruses which are being transmitted to crows. I have come to know that crows are dying in large number in some part of India, Kerala and maybe Haryana, etc. So I'm sure that crows virus can be isolated, and we can culture, we can put to decipher the genetic code, and therefore very soon we'll have a solution in terms of vaccine. So culling is the answer at this point of time. We'll cull those birds which are infected in a large number, so that we can't really isolate them in that way. So you have to cull them as much as possible and ward off from spreading to other parts of
India. Okay. Sir, one more question is there from Manav Sharma. He wants to ask, sir, any recommendation for a research proposal related to medicinal technology course in Mumbai?
I don't know what kind of research project you want to, but I think anything which is related to health science is always welcome, because there is a huge, I think that there is a lot more issues which we keep thinking actually that this should have been different, this should have been different. But then we don't somehow, as Dr. Chawla very rightly said, that we don't have much, we don't move in that direction. as a country as a whole, as a maybe a civilization, I will say, even in America, my friends are there, they don't have much of collaborative project as it should be. Harvard and Massachusetts have collaborations, and some of those top universities of US, but otherwise still a lot more can be done at a much faster pace. But a lot of things, you can talk to me on individual basis, you can have my phone number, we can suggest to you what all projects you want to carry out. Thank you.
Sir, one more question is there. What is the main reason for brain stroke?
Actually, this again is a very important question, but I think a little larger to address because stroke is by and large is a non-functional brain because of vascular insufficiency. So blood vessels either get clogged or disrupted to produce a stroke. The part of the brain is lost, so function of the body is lost. If it is hemiplegia, that means one part of the cortical, one half of the cortex, important part, the motor part of the cortex is gone. So likewise, different part of the brain will produce different syndromes of stroke. So stroke is the insufficiency, sudden insufficiency of blood supply to one particular part of the brain or central nervous system, which leads to paralysis of one part or one body part function. So that is a stroke. It can be because of ischemic stroke, can be hemorrhagic stroke, can be a combination, can be sometimes metabolic reasons also. So there are various types of it.
Sir, one more question came. He wants to ask, is COVID-19 pandemic going to serve as an engine to innovation in medicinal technology?
Sure, I think all such crisis, gives a lot of ideas, a lot of thoughts. All active brain must be thinking that what we got out of it. At the end of it, once we are still grappling with the COVID itself, but then problems are coming and we have got answer. For example, this messenger RNA. For the first time, we are getting a messenger RNA vaccine. It was not there before. That had never been tested. One of the biggest limitation of this vaccine has been messenger RNA not being used before as a vaccine. Now we know that there is no more DNA, no more protein, no more peptide. We have gone to the units of which makes protein. So maker of protein is a messenger RNA. So we have got a vaccine against those structures which make the antigens, and therefore now we are come to a level which is far, far niche, and therefore this is one very good example. Once we find out success of this messenger RNA vaccine, not other vaccines have been tried before also. So we will be step ahead in understanding of not only vaccine, but many other immunological processes, and newer drugs, newer vaccines will come much faster.
Thank you, sir. So I think, Deepi ma'am, this was all about the question and answer session.
Okay, thank you so much, Vivek sir. Thank you so much, sir, for answering all the queries beautifully. So moving ahead, now I would like to invite Mr. Vivek Singh Rathore, Assistant Professor ET&T, to coordinate the feedback session. Vivek sir.
Thank you, ma'am. So for feedback session, I would like to call some students. Hridesh Agrawal, he's from first year, electronics branch. Hridesh, are you there?
Yes, sir, I am here. Thank you, sir, for giving this opportunity.
Can you on your video?
Hridesh, you can join on your video.
Okay, let it be if it is not happening. So
it's okay, you may continue.
Thank you very much for giving me this opportunity. Firstly, I want to thank Dr. Jha for giving this precious knowledge to us. I want to say a very big thanks to you about telling us a history about the medical science. I personally want to thank about explaining the sign of medical science. Actually, I always wonder why there are snakes drawn on the sign of medical science, which Dr. Jha explained us very efficiently. Thank you very much, sir. Sir, I have become a big fan to you. Thank you very much, sir.
Thank you, Hridesh,
Thank you.
for your wonderful feedback. So, in this series, I would like to call Diptanshu Srivastav. He is from mining branch and he's also from first year student. Diptanshu, are you there?
Yes, sir.
You.
Firstly, I want to say thank you, sir, for providing me opportunity. As a feedback, I want to give, sir, as thank you for the information what you have given. That is all about the history of the Nobel Science and how the scientists and how the doctors have given such inventions for the various diseases. And I hope from this that we all engineers also from this present to till future we can work together with the medical science and coordinate to give a better future or better life better lifestyle future to the future generation. And we can also, like you said, that there is a one third of the cancer is still unknown or present, that which we all not know. So hope in future we can also can cure such type of diseases which is not till now, which cannot be cured, like whether it is cancer or Alzheimer diseases, or whether it is a motor neuron diseases. So thank you, sir. Thank you, sir.
Thank you, Diptanshu. And in last, I would like to call Ashwarya Singh. He's from mechanical branch and from first years. Ashwarya, are you there?
Aishwarya, could you listen to us?
Okay, I think some network issue may be there. Okay, so I think he's not there, ma'am. So you may continue, ma'am.
Okay, thank you so much, Vivek, sir. There are a few queries regarding the feedback form. So you could now share the link regarding the feedback form and certification in the chat box, so everyone could avail it.
Yes, ma'am. So I'm sharing the link of e-certificate and feedback form. All participants need to fill it, and then your e-certificate and will be mailed to you in the email ID which you will provide in the Google form which I'm sharing.
The registered mail ID. Okay.
Okay. Ashwari, are you there? You came? Okay. Sorry, I got disconnected. Okay, no problem. So
yes, sir, I am here. Actually, my network got disconnected.
Okay, Ashwari, please continue.
You are welcome. You can speak something if you want.
All right. First of all, I would like to thank Dr. Rajendra Jha for giving us a detailed presentation on history and development in medical sciences. Medical sciences and technology has always been a field of fascination for me. So I am sure after listening to this definitely a great presentation by Dr. Rajendra Jha, there will be an incremental increase in my fascination. Thank you, Dr. Rajendra Jha, for this great presentation and great expert talk. I am really grateful to have listening you today. Thank you.
Thank you so much, Ashwarya. So this is all with the feedback session. Vivek sir, can we move forward?
Okay, ma'am. So I have shared the link. I think, is it visible, ma'am, to you?
No, I'm not still able to
okay
get that feedback form. So feedback form will be shared shortly. You can access that feedback form from the chat box and you could fill it and avail your certification. The certificate will be mailed through the registered mail ID. So that's all. Now moving ahead in the series, I would like to invite Mr. Dikeshwar Verma, Nodal Officer SPIO, Chhattisgarh, for vote of thanks.
Good afternoon, everyone. I would like to thank you, our guest webinar speaker, Dr. Rajendra Jha, for enlightening us with their knowledge. I am pretty sure the precious knowledge that Dr. Jha gave us will definitely help us. I am also thankful to Chawla sir, Principal GC Bilaspur, and his team for the support given towards this webinar. I am also thankful to Mr. Diwakar Misra, SPA SPIU Chhattisgarh to organizing this webinar session. Also, thank you to all the participants, faculty members, and students for paying your attention. Thank you.
Thank you so much, sir. With this, here we come to the end of this session. Thank you so much, Rajendra sir. It's really a tough task to summarize a 4-decade-long experience in an hour, but you did it quite in a good fashion and a commendable way. The way you have deliver everything, and especially the integration of technology and evolution in medical science, was quite interesting and very helpful in broadening our horizons. So thank you so much, sir, for finding time and blessing us with your knowledge. Thank you so much, sir. And before wrapping up, I would like to thank you one and all presented here to find your time and effort to make this session a successful one. So thank you everyone again and wish you a good day ahead. Thank you so much.
Thank you, Dr. Jha sir.